we look at our boarding crisis right now, some people look at it as an acute caused by COVID. That's actually probably one of the biggest falsehoods. This has been going on since the age of time, right? So if you go back and Google boarding crisis, you can find articles back to 2005, 2003. Most recent literature probably around 2018, 19, with now more studies coming out. But it reached such a level that the ASAP Organization for Emergency Medicine actually crafted a letter, sent it to the White House. It's now been endorsed by several specialties,
including Society of Hospital Medicine.
Society of Hospital Medicine, and which is important because this is a great example of teamwork. It has to flow together. But what we've done at our organization is really dive into is what is going on the floors. What are the delays? What is it? Discharge lounge is a great idea. We found that our maintenance crews would come in and clean the room and it would be ready, but we had to wait for the nurse to turn it ready. So can we let them start to turn it ready in Epic and then force that up there? Where do patients belong? Do they belong in the hallways of the emergency department when there's overcrowding, or do they belong in the hallways of the floor? That's a big hot button, right? Because one of the reasons that they're backed up in the ED is there not enough nurses on the floor. As I mentioned, there's not many nurses going into med surg anymore. So then you're looking at, well, do you pay agency to keep beds open? So we've decided not to pay agency, which is the right move, so we can reset the labor standard that's gotten so out of control since the pandemic. So that's caused more boarding and crisis in the emergency department. Then you have to look at some of the solutions where we're going to do more frequent rounding in the emergency department. Well, that's great. That creates more orders for the ER nurses to do while they're trying to take care of acute care and throughput. So we got them to give support to the ER nurses and send people down when they could so they can process these orders. The emergency department has long been the solution for this, and the solution has not ever fixed the problem. So now people are re-looking at it.